Hello everyone, this is Dr. Nima and this is our lecture for Dental Science Chapter 2, and it is about the tooth. We're going to talk about different functions and terms that is related to the teeth, and we'll know the tooth surfaces, we'll know some other landmarks that are found on each tooth, we'll know different types of teeth. So we'll talk about general things, and it's an important lecture. Okay, so we'll start with what are the main functions for the teeth. Definitely we know that is protection, so it protects the mouth in general and kind of also help with saving the bone. When we have the teeth and they're functional, it can protect the bone that it's in, and that keeps it more vital. Digestion, right? So we can eat. Speech, so it's teeth are really important in speech, and that's why sometimes when people do complete dentures, they have to relearn how to speak in a way. We always advise them to start reading newspapers out loud a little bit with the new dentures, so they can get used to the type of the new teeth that they have. And same times with people that have a lot of orthodontic movements with their teeth, they might actually need to kind of learn how to speak again in a way, like, the sounds sometimes, and definitely appearance. So these are like four main functions that we know of the teeth. So this is we kind of talked about this before, about the tooth layers and parts and structures, and this is a more bigger picture that will show us all of the parts. So the tooth in general is separated into two parts. You have the crown of the tooth, and you have the root of the tooth. So you have crown and you have the root. So these are like the two main parts of the tooth, and this other small part here that is called sometimes the neck of the tooth. So the crown is usually the part that is above the gum and that is covered by enamel. That's what we call the anatomical crown. It is covered by enamel. We know that the enamel is this layer, right? It covers the crown part of the tooth, and that is the crown. The root part, or the anatomical root, is the part that is covered by cementum, and we know that cementum is this layer here that surrounds the tooth on the root area, right? So we have crown and roots, and then the neck of the tooth. So since we talked about this is enamel, and enamel is the strongest layer of the tooth. It is the most outer layer. Again, it covers the crown. The crown also, the enamel also has like a translucent color in a way, so you can see the dentin that is underneath it. And generally, the enamel also, we said that it actually has some enamel rods or enamel prisms. That's the way that it's made, and it's shaped. Under the microscope, you can see it this way, and that's the first outer layer. The second layer of the tooth is the dentin, and that is here. The dentin. The dentin is the part that is kind of make most of the tooth, right? It makes most of the tooth structure. And the dentin actually also have some small tubes that we call dentinal tubules that are formed all around. And these are also play a role in the tooth sensation, because technically they act as some tubes that can get all the way to the nerves and the pulp underneath it. The dentin hardness is almost like the hardness of the bone, while the enamel is harder than that, and that is the dentin. The other layer is the pulp, right? We know the pulp is the area that has the nerves and that has the blood supply. But the pulp itself has two parts. You have the pulp chamber, right? And you have the pulp canal, or sometimes we call it root canal, right? So the pulp canal or the pulp chamber is the part of the pulp that is found in the crown part, right? So we know that this is the crown, and the pulp chamber is the part of the pulp that is found in the crown part. The pulp canal or the root canal is the part of the pulp that is found in the root area of the tooth. And the last layer of the tooth, technically, is the cementum, and I covered it here a little bit, so if I erase this, that is the cementum. And we know that cementum is the main part of the tooth that helps attach it to the bone, right? The bone that surrounds the tooth is the alveolar bone. So this is all of the bone is the alveolar bone. But since this part is the part that kind of goes up and hugs the tooth, we call this the alveolar process. And these things that connect the tooth to the bone, we already discussed these. These are the PDL, which means the periodontal ligaments. Oops, I am erasing. Periodontal ligaments. So these are the periodontal ligaments. What else that we have? The last part of the tooth, the end of the tooth, this part, usually this is the apex or the apical third. So this is the apex per se, that area at the end. And that opening that is in here, we call it the apical foramen. The apical foramen is the opening at the end of the tooth that the nerves and the blood supply pass through to the pulp. That's the apical foramen, that's the apex. This part there is for the sulcus. So this arrow here is for the sulcus. And we know that this is the gum or gingiva. And we have one more thing, which is the tip of the enamel. We call this a cusp, which is that elevation that we have. We'll talk about these elevations in a little bit. Usually molars have 4 of them. Sometimes we can get 5. So these are the cusps. So these are the parts of the tooth that we have to know right away. It's very important to understand them and know them. We talked about the crown, and we said that the anatomical crown is the part of the crown that is covered by enamel. We have another term, which is the clinical crown, and that is the part that is visible in the mouth. So this picture really shows it. Let's say this is a patient that has some bone resorption, so part of the root is actually appearing in the mouth. So when we say a clinical crown, we say whatever showing of the tooth inside of whatever visible inside of the mouth, that's the clinical crown, because we can see that technically in the clinic. The anatomical crown is just the anatomy of the tooth, and you can see the anatomy is the crown is just the part that is covered by enamel. So that's the main difference between the anatomical crown and the clinical crown. You can see again, these are examples here on the side of the clinical crown, even though it's not showing. And same thing here, this is still clinical crown. So if this is the clinical crown, right, this is all the clinical crown, this small part. So this is the clinical crown, right? While this is the anatomical crown. So that would be anatomical, and this would be clinical, right? So the part of the tooth of the crown that is seen on the tooth, on above the gum or visible in the clinic. So this is what we already talked about. Just like a recap, if we missed something, the enamel covers the anatomical crown, right? It has some translucency, which means the light can pass through it, and that's why usually the color of the tooth is a reflection mainly of the dentin more than the enamel itself. The hardest tissue in the body, and the enamel, we said it has the enamel rods or the enamel prisms, and we know that these are just lines of the enamel that are there. For dentin forms most or the main portion of the tooth, as we said, because it covers the tooth on the crown and on the root part. It's hard and dense and also have some elasticity. Its color is about yellowish in color. That's the main color, again, that reflects through the enamel. Dentin actually can heal itself in some conditions by creating a secondary dentin. So we'll talk more in depth about that later on. But dentin, technically we have primary dentin, which is the dentin that is formed by itself. And then if something hits the pulp or close to the pulp, sometimes the tooth can heal itself by creating a small layer of dentin that we call secondary dentin. And it has the dentinal tubules that I was referring to earlier, and these are the dentinal tubules. Again, these are just kind of tubes that are open that connects on the outside with the enamel rods and prisms, and here on the outside with the cementum. And again, these would play some role in the sensation or the sensitivity, tooth sensitivity, if they're open. Okay, continuing on, again, the pulp, we already talked about these things here. So the pulp is nourishing and sensory, so it has the blood supply that is nourishing, and sensory because it has the nerves. So blood supply, lymph, connective tissue, and nerves. The pulp actually has three main parts. As we said, two main, which are the pulp chamber and pulp canal, right here. So you can see these are the root canals or pulp canals, and we have the pulp chamber. These are the two main parts. 1 and 2, doesn't matter, 1 or 2. But we also have another landmark on the pulp, which we call the pulp horns. And these are the extension of the pulp, these parts actually, this one part and this one part, that is elongated towards the cusp. So technically, the pulp shape or the pulp chamber shape follows the shape of the crown of the tooth. So if you have some cusps here, these will be elongated, and these areas will be called pulp horns. These are things to think about, you know, the dentist would think about when they are drilling a tooth. So again, if they're like drilling here, there's a lot of space here, but they know when they get closer, they might touch a pulp horn. And a lot of times, this is where the exposure happens, because we're trying to clean the tooth here in this area, and then we just touch a little bit of the pulp horn, and that will expose the pulp, and then it might be fixed, it might not, by creating secondary dentin. Anyway, cementum, we know that it covers the root. It is bone-like as well as the dentin, and it's the main thing that is provided the attachment to the alveolar bone through the periodontal ligaments. And that area where the dentin, the cementum and the enamel meet, this area here is called the cemento-enamel junction, or CEJ. Right, that is the area that is here, and technically this is the cervical line. We call it the cervical line. You'll see it more in the other slides. Okay, again, a lot of things that we already talked about. These slides are more just for kind of summary of what we talked about in the pictures. So crown is covered by enamel, and we can say actually anatomical crown to be more specific, because clinical crown can be covered by cementum, right? And same thing, anatomical roots is covered by cementum. Right? We said about that. The cemento-enamel junction, which we talked about it, that's where the enamel and the cementum meet, right? That is also called the cervical line. And technically the cervical line is where, you know, around the gum, if the gum is healthy, so that will be the cervical line where the enamel ends and the cementum starts around the tooth, right? That's all the cervical line. So crown and root join at the cervical line, same thing. The apex, we said it's the end of the root, that area at the end of the root, which is here, right? That's the apex. And the apical foramen is the opening at the end. So that's the apex, and that's the apical foramen. The alveolar process, that is the support the tooth. Again, we have seen it here. That's the alveolar process, because that's the part they said that supports the tooth. All of it is called the alveolar bone. And the socket is called the alveolus. So the socket, this socket, all of that, like the actual part that holds the tooth here, is called the alveolus. Okay, that's the tooth socket. Okay, this is for you so you can kind of see all of these written down. Okay, now for the roots. So we have teeth that have single root, and we have teeth that have 2 roots, and we have teeth that have 3 roots, right? So the area where the roots actually split or divide, we call it the furcation area. So the furcation area where the roots of multi-root teeth would divide. So again, this is the furcation area here. So if it was only 2 roots, like this one, we call it bifurcated. If it was 3 roots, like this one, we call it trifurcated. So which teeth has 3 roots? Maxillary molars. Only maxillary molars. Only. Well, maybe some third molars, because third molars can be anything, like on the mandible, but mainly, and it's the maxillary molars, or normal teeth. The bifurcated ones are the mandibular molars. So the mandibular molars, like this, has bifurcation. The maxillary molars, like that, has trifurcation. Another tooth that might have bifurcated or 2 roots are the maxillary first premolars. Okay, now let's talk about the teeth. So these are the adult teeth. We know that we have 32 teeth, right? We have 6 anterior teeth and 6 posterior teeth. Anterior teeth are here. These are all anterior teeth. These are anterior teeth. And posterior teeth are on each side, definitely. Posterior teeth, right? So this is kind of just to show you a bigger picture, because we're going to talk about each tooth separately, so you can kind of have an idea of where the teeth are. So starting here, these are all incisors. These teeth are all incisors in the middle, right? These are incisors. We have central incisors. These are central incisors here and here. And we have lateral incisors. These are lateral incisor, and lateral incisor, right? We have canines on each side, so 1 and 1 and 1, right? These are our anterior teeth. So anterior teeth include canines, laterals, and centrals. Posterior teeth include first premolar, second premolar, and then first molar, second molar, and third molar. Right, and same thing on the other side. So again, this is mainly a picture for you to go back to if you want to have an idea where the teeth are kind of in a mouth set. This is what this is for. Okay, so just a few things to go through before we go forward. We know that the maxillary arch, or the upper arch, is called maxillary. So that's the maxillary arch, and the lower arch is the mandible, or the mandibular arch, and that's why we call maxillary teeth and mandibular teeth. We know that the adult teeth, we call them as well permanent, and there are 23. The baby teeth, we call them primary or deciduous, and these are 20 teeth. Succedaneous teeth are the adult teeth that actually replace the. Now let's take a look at our teeth. We already talked about that, but again, we're going a little bit more in depth about each one of these teeth. So these are the incisors, and these are the canines. These are the premolars, and these are the molars. Right, so we have 4 types of teeth: 1, 2, 3, and 4. Now let's talk about incisors. Incisors have 2 types. We have laterals and centrals. Incisors have only 1 root and has no cusps. Right, we said this is a cusp, which is the elevation. This is a cusp, this is a cusp, right? And these are cusps. So incisors are the only teeth that don't have cusps. Instead, they have what we call an incisal edge. Incisal edge. They have 1 root and no cusp. They're used for cutting the food. And what else? I think that's mainly it. Okay. For canines, and technically there are 8 in total, but we'll get to that as well. So canines, you have 1 root and 1 cusp always. You have 1 cusp and 1 root. The canine roots is the longest, so the tooth technically is the longest from, all the way. So the longest root, and that's why it is more like more fixed in the jaw, and we call it also cuspid because it has only 1 cusp, and also sometimes we call it the cornerstone of the mouth. The cornerstone of the mouth, right? And that is the canine. The premolars usually have 1 root and usually 2 cusps. The maxillary, if you remember, the maxillary first premolar usually have 2 roots. So most of the premolars have only 1 root, but the maxillary premolar, first premolar has 2 roots. And usually the 2 roots are not like these that you see on a molar, but it's more like at the end, it just have 2 roots like that. So it's smaller 2 roots, not like completely all the way bifurcated, but still, right? What else? They call them also bicuspid because they have 2 cusps. Some actually do have 3 sometimes, but the most would have 2 cusps. Molars, on the other hand, they usually have either 2 or 3 roots, right? So 2 roots on the mandibular molars and 3 roots on the maxillary molars, like we said. And usually it has 4 cusps, and sometimes we have 5 cusps, especially with the maxillary first molar. So these are the main things. Here we have them also listed. So see, the incisors are 8 total, 4 centrals that in an adult teeth, 4 lateral, 1 root, no cusp, incisal edge instead of the cusp. They're used for cutting. We forgot to mention that for the other teeth. And shaped like a shovel, so like it's concave a little bit on the lingual arch, on the lingual surface. Canines 4, 1 and 1, cutting and tearing. Longest root, as we said, called bicuspid or cornerstone. Premolars are 8, 1 and the first and the second premolars, right? They usually have 1 root, 2 cusps. Only the maxillary first premolar most of the time would have the 2 roots. They're used for grinding, also called bicuspid, and they're not found on the primary teeth. Molars, they have 12 because we have the first, the second, and the third molars. They have 2 roots on the mandible, 3 roots on the maxillary arch, 4 cusps, and the maxillary first molar would have 5 cusps. Small cusp that is non-functional cusp, we call it cusp of Carabelli, but that is something else. Grinding and chewing, that's the use of it, and the third molar is not present in the primary teeth. So remember, we called these non-sextidaneous teeth, right? The premolars and the third molar, they're considered as non-sextidaneous teeth because they do not replace any existing teeth. Okay, if we are going to talk about these teeth and we want to know the surfaces, we have to split them into, again, anterior and posterior, which again we already talked about, but this is more to picture it. And usually you can put a V shape, and that V shape would split your arch into anterior teeth that are here and posterior teeth that are on both sides, right? These are the posterior teeth. We know that this is the central, that's the lateral, canine, and then first premolar, second premolar, first molar, second molar, and third molar, right? So here, just like a table, so we can know them. On the anterior teeth, we have again the central incisor, and we have how many of them? How many central incisors we have? 4. And then we have the lateral incisor, and we have also 4. And then we have the canine, and we have also 4, right? So 4 canines, 4 laterals, and 4 centrals. My cat wants to get in here to study with us, but I'm not letting her in. Okay. The posterior teeth, we have premolars and we have molars. Premolars, because we have 2 of them on each side, that equals to 4 on each arch, but 8 total. Whoops, here we go. And for molars, we have 3 on each side, which means 6 on the arch, which means 12 total. So if you add this up, you'll get to 32 teeth. Okay? For the baby teeth or primary teeth, and by the way, this is the permanent. So for the baby teeth, again, same thing. We're going to split that into anterior and posterior teeth. So this is the anterior, these are the posterior, and you can see that the anterior are the same. So we still have central incisor, and we still have 4 of them. We have lateral incisor, and we have 4 of them, and we have canines, and we have 4 of them, right? But the main difference here is that we don't have premolars. We only have first and second first molar, and second molar. So we don't have premolars, that's why we have molars, and molars here are 8. So if you add this up, you'll get to 20, which is the number of the primary teeth. Permanent is 32 and primary is 20. Okay, so that is really important to understand, because the next thing that we're going to talk about will be the surfaces. Okay, this needs a lot of attention. So we already talked about this view for now, right? Which is each tooth, technically we can split it into 2 sides. Each tooth. So there's one side that is distal, and there's one side that is mesial. And we know that the distal side is the closest to the arch, as away from the midline. So this is the distal. That's the distal. Oh, no, I want to be more specific here. So let's take this. This is the distal. And that's the distal. See the edge of the tooth. That surface is the distal. So that's the distal. And here on the other side, see, now we flip our hand technically. And this is the distal. So I'm going to color code it because hopefully this would help. So away from the midline is the distal surface. Right. Towards the midline is the mesial surface. So this is the mesial. That's the mesial. That's the mesial. Let me make this a little bit bigger so I can do this easier. That's the mesial. That's the mesial. 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 And again, see these, the central incisors are the only one that have mesials facing each other. And that's the mesial. That's the mesial. That's the mesial, mesial, and mesial. Okay, so that is the mesial. We don't call it medial on the teeth, we call it mesial. It is towards the midline, right? But that's mesial. And kind of to, again, remember it, M is midline and D is distant from the midline, so distal. So mesial and distal. Okay. What are the other surfaces that we have, that we said that we have? We have also the labial surface. And these are the teeth that are facing the lip. We cannot see it here because here we're only looking at the teeth on the lingual surface of them. So we're looking from inside of the mouth, so we cannot see that. But that is the labial surface. Where is that? That's on the anterior teeth. Remember the anterior teeth that we said? They're here. The same surface, the same view, on posterior teeth, we call it buccal. Right? Well, actually, you should change the color so we still do our... I want to delete maybe these so that you don't confuse yourself with that. So labial are these surfaces here on the front that we cannot technically see. They're there, right? Buccal I run out of colors. Buccal are the surfaces again on the outside here on the posterior teeth. So if we want to gather both of them, we can kind of refer to as facial, but usually facial is used instead of labial, and I'll tell you why in a second. So facial technically represent all of these. As you can see, it covers all of the teeth, but most of the time when we talk in dentistry, when we are, describing anterior teeth, instead of labial, we all usually say facial. Okay, what else? What other surfaces that we have? We have these surfaces that towards the tongue. See all of these here on the anterior teeth, and also on the posterior teeth. See this? That is towards the tongue on either side, and that is called lingual surfaces. And these are, again, the surfaces that are towards the tongue. Let's see what else. We have more surfaces to go. We have the surfaces that are on the occlusal, on the biting surfaces, the top surfaces of posterior teeth. These, we call them occlusal surfaces. And one more, I hope that I didn't forget anything else, and that would be the, I'm trying to find a good color, maybe this blue. Whoops. This is the incisal edge, right? Remember we said we don't have a cusp on the anterior teeth. Instead we have edge. So this is the incisal edge. Okay. Now let's gather these around and see if they are the same. So we're just here listing of the surfaces. On the anterior teeth, what do you call them? And on posterior teeth, what do you call them? So, on the distal, let me change colors here. Starting with the distal. On anterior, we call it distal. On posterior teeth, we still call it also distal. So there's no difference. We use distal for anterior teeth and for posterior teeth. The same. As you can see, the colors are exactly the same across the board. Right. Mesial, same thing. Mesial. It is, you can remember Z, mesial, right? So mesial is the same, because on the posterior teeth we call it mesial if we're mentioning these surfaces, that is towards the midline. And anterior teeth also we call it mesial. Same thing, right? Now lingual, let's see the color, if I can find that color for lingual. I think that's the one. Is also the same. Lingual on anterior teeth and lingual on posterior teeth. See, again, we use the same color on anterior and on posterior teeth. It's both lingual. Now the only two surfaces that we call them differently between the anterior and posterior are the occlusal. So on posterior teeth we call it occlusal, right? But on anterior teeth, what do we call it? We call it incisal. On posterior teeth, we call the surface that is on the outside buccal. Whoops. We call it buccal. While on the anterior surface, we call it labial. Right? Again, this needs a lot of attention and a lot of thinking, and again, that's why I wanted to kind of color code it. You can see these surfaces are labial, these are buccal, and these are the occlusal on the top, and instead we call them incisal on the anterior teeth. So just to know, and again, if when we were talking about the, I have to put facial here, but in a minute. The labial, remember I said we're not using labial for the anterior teeth. Instead, usually we use facial, because when we are using these surfaces, we usually use the first letter of them. So when I say, like, there is, I can say an MOD cavity on tooth, let's say number 2, a molar has an MOD cavity, you know that I mean mesial and occlusal and distal. So if we're using the same letter, so if I use L, you will ask me, is it lingual or labial? That's why we usually use facial on the anterior teeth. So it can be labial or facial, but especially again when we're writing things, we write F instead of L for anterior teeth. So that's kind of makes the difference. Another thing to note is that the lingual on the maxillary teeth, sometimes we call it palatal because it is related to the palate. And again, this is more to describe things more than to actually describe a cavity. So that also can happen. Distal and mesial both, these are called interproximal surfaces. You know, when we say interproximal, when we say there is a, you know, you have to floss interproximally, you know that we're talking about the distal and mesial surfaces. Okay, let's take a look at this here. This is a little bit more 3D. Now we can take a better look at our surfaces here. So starting with number 1, you may stop the video here and then try to figure them out yourself and then continue. Okay, so number 1, you can see, well, first of all, we have to see that this is the midline, right? And the midline separate the teeth to 2 halves, right? And we know that each tooth is technically have 2 parts in it. One that is towards the midline, that is the mesial, and one that is away from the midline, that's the distal. So number 1 is distal. Number 2, again, if we see here, and these are interproximal, you can see they are between the teeth. There's no teeth here technically, so just to be able to view it. Number 2, or surface number 2, is away from the, towards the midline, and that is mesial, right? Number 3, is it labial or facial or buccal? We have to go back and see. So number 3 here is a premolar, right? And premolar is a posterior tooth. So you see on posterior teeth, we have the surface, then posterior teeth, we call it buccal, not labial, right? So this is number 3 is buccal. Number 4 is the same surface, right? See, it's on the same side. It's the outer side of the tooth. But because this is an anterior tooth, it is labial or facial. Again, that's okay if you type any of these. I should change my color because I'll accept that, and you know, until you start maybe doing the charting, and then that's when we have to switch to facial more than labial. Number 5 is on the side where the tongue is, right? That's the side where the tongue is, and that's why it is lingual, whether it was anterior or posterior teeth. Number 6 is on the top surfaces of the teeth, right? So number 6 is occlusal, because again, it's also a posterior tooth. You have a premolar here and you have a molar here. And then number 7, which you see here, the small thing here, that is the incisal edge, right? So this is a good training for you to be able to figure out the teeth surfaces. And again, you might, you know, like this here, what is that? This is a lingual surface, right? Because it's on the lingual side where the tongue is. How about this one? This is a buccal because it's towards the outside and it's a posterior tooth. How about this? This is a facial or labial because it's an interior tooth. How about this? That is actually a lingual surface because it's towards the tongue, and so on and so forth. So again, this is really important to study and understand, and you have these empty on your PowerPoint, so you can always practice with these. This is just another picture to kind of show you a little bit. You know, this is all the facial. You can see it goes all the way around. This is the buccal on the posterior teeth. That's the labial on the interior teeth. Mesial and distal on each tooth. Buccal here again. All of that is occlusal, and all of this is incisal. Anyway, so hopefully this again would help with you know, different people learn in different ways, but these are also some surfaces you can see: incisal, mesial, distal, palatal here. That's what we were mentioning because it's towards the palate. So on maxillary teeth. Lingual surfaces, occlusal, interproximal surfaces, a proximal area for contact, and these are facial surfaces. So again, a recap of what we talked about the tooth surfaces. So you have interior teeth has 4 surfaces and 1 edge. Remember we said we don't have a cusp, we have only an edge, so that doesn't technically consider as a surface. Instead, it is considered as an edge. While posterior teeth have 5 surfaces, and again, if we want to address them, they're mesial, distal, occlusal, lingual, and buccal. While here, the surfaces are mesial, distal, instead of occlusal, that's the incisal, which we'll talk about, but also we have lingual and facial, and the 1 edge is the incisal. Okay, so these are the surfaces that we have. And again, these are mainly definition: lingual towards the tongue, facial towards the face or cheek or lip. Well, we have labial as well. Interproximal, that is between the teeth. Mesial and distal, you know, away and towards and away. Occlusal and incisal, which again, we all talked about this before. So now if we want to divide the tooth, or technically each tooth is divided into 3 parts from each side. So the root is divided, the crown is divided, and the tooth itself longitudinally is also divided. So we have a middle third. So this is helpful in describing things. When we want to describe a cavity, and we, you know, that's what we will do all the time. We will say, you know, mesially, distally, occlusally, or the middle third, the mesial third, or so. This is your new language that you talk and understand, and it will help you to be able to communicate and describe that things that are on the teeth. So that's what it is for. So this can be the mesial third, and this is the distal third, right? Same thing here. So this is the middle third, and you have the, most probably this is the mesial, that's the distal, and it's okay if you mix them up here. We're not here to identify which tooth it is. These are longitudinally, right? You can see it goes up and down. On the crown side, you have the incisal third, while on the posterior teeth, because this is a molar, you call it occlusal third. Again, we have the middle third and middle, same thing. And then you have the cervical third, or cervical. That's the cervical third as well. That's on the crown part, right? That's the crown part. And on the root part, it's also the same. So this is the cervical third on both of them. That is the middle third on both of them, and that's the apical third on both of them, because again, this is the apex region that we have here on both of these. So this is again just mainly to understand these things, to be able to describe it. Same thing here, we have a recap on all of that, and again all of these are already written for you so you can take a look at them and to study them. But again, this is more to as a description. Okay, continuing with descriptions. So for each tooth we can treat it as a box technically. So you have a box, right, because it has 5 surfaces, especially here for the posterior tooth that we have here. And if you look here, we have the buccal. This is the buccal surface, and we have the distal, and this is the distal surface. So we have what we call line angles and point angles. A line angle is joining of 2 tooth surfaces, and a point angle is joining of 3 tooth surfaces. So you can see here, like, this is a point angle because it is, by the way, this is the mesial surface, and this is the lingual. So the mesial on this side, and the mesial is on this side, and the lingual is on this side that we're seeing here. We're not seeing. So a point angle is the gathering of 3 surfaces. So this point angle, we call it bucco-occlusomesial, right? Or mesio-bucco-occlusal. Don't worry about how you start and how you end. Like, are you starting with buccal or mesio or lingual? I mean, it doesn't matter for me. But you can see, like, this is an example for it. It is mesio, which is mesial, and lingo, which is lingual, and occlusal. So because that's the occlusal surface. So because it's between 3 of them. A line angle is the angle between 2 surfaces. So in this example here, we see that this is a disto-lingual because you have a distal between the distal surface and the lingual surface, right? Same thing here. You have the mesio-buccal. So you have the mesial surface and the buccal surface, and that's a line angle, and the other one is a point angle. So again, these are things to mainly be able to describe areas and cavities and things in it. Okay, now we'll talk about some landmarks, and we'll almost be done with this chapter. Landmarks on the tooth. Okay, these things here are called lobes. And these are the growth areas of the teeth. We'll talk more about these growth areas later on, but technically these are the areas that form the crown of the tooth, and usually each tooth has 4 lobes. You know, some of them would have 5, but mainly have 3. So these are called lobes, which are just growth areas. You can see that, like, the anterior tooth has 3 lobes. This is the first one, this is the second one, and this is the third, and the 4th one is on the back. Like, if you flip the tooth, you'll find this on the back. That's the 4th lobe. So once these, at the beginning of when the permanent teeth are appearing, you'll see that the permanent teeth would has these 3 ridges that we call, and again you can see it here. So you'll see it in, you know, kids that still just have their permanent teeth appearing just now. These are called mamelons. Mamelons. So the mamelons are just these 3 ridges that appear on anterior permanent teeth, and they would wear off as the person start using their teeth. And usually, if they are kept like that for, you know, more older age, that means the patient have some occlusion issues. That means they're not biting on these, or they're not using them, and that's why they're not. They still have these ridges in them. Anyway, continuing with the lobes. So, you know, we have multiple lobes here. When you have the area between 2 multiple lobes, we would have developmental groove. So it is the groove or the area, you know, the depression between the two lobes, right? And again, these lobes mainly would form the cusps, and we know the cusps are the elevation on the tooth surface, on the enamel surface, and they are mainly a lobe growth. So these are cusps. Again, this is a cusp, this is a cusp. Anterior teeth, we know that they don't have a cusp, but what they have on the back here, and again you can feel it on your anterior teeth, on the lingual, you know, this is the lingual surface. This is the lingual surface. They have something called cingulum, and that's a bulge that is found on the cervical third of the anterior teeth on the lingual side. And again, you can feel it with your tongue. That's the closest area, the closest thing to the kind of a cusp, but it's not a cusp again technically, and that's what you have on the anterior teeth. Other than that, we know that we have pits and fissures. So the fissures are the lines, you know, even these developmental groups would have fissures also. So these are small lines. These are fissures, small lines and small groups that run, you know, on the lowest parts of the teeth. And we have where these fissures meet, we call it pits. And these are the deepest part of the fissures, and usually that's where the cavity and food gets stuck. And that's where the cavities start usually, because we cannot brush it well. Another thing here, we have a ridge, which is technically an elevation on the mesial or lingual side, so we call it a ridge. We have contour. Also, the contour is that, you know, each tooth has a contour on the lingual and the buccal or facial surfaces, and even a contour on the contact area. And these are usually things in the anatomy of the tooth that helps self-cleansing. So technically the food would not get caught in there and will be cleaned by itself regularly, and that's what we have to think about when we're restoring a tooth, to restore the contours of the tooth. If it was, you know, inside contour, we call it concave, and you know that most probably, definitely, and convex is on the outside. And again, these are the definitions that we talked about. Lobes are the growth center. Most crowns will have 4 or more. Developmental groups are the fusion of these lobes. Cingulum, the lingual lobe on the anterior teeth. Cusp, that is the elevation formed from the lobes. Again, that's the elevation part. And we know that anterior teeth don't have cusps. Ridge, that's the elevation portion on the side of the tooth, you know, in a line on the side of the tooth. Usually we do have some ridges in the middle, but marginal ridges, well, these are the marginal ridges, and we have transverse ridges. So a ridge in general is the elevation. Marginal, these are the ones that are on mesial and distal. We have oblique ridges that run in the middle. Fissures, we talked about them, deep grooves run on the tooth surface. Pits, the deepest points of these grooves. And contour, the curve of the surface. And fossa is a depression or concavity. So sometimes, you know, some teeth would have some fossa in the middle, which is just a little bit of depression. This is a very important chapter in general in the study for the teeth, and understanding and knowing all these parts and terms is really important for your study, and to understand dentistry, and to be able to recognize things and talk the technically dental language. Surfaces are super important, so hopefully you will be practicing a little bit on these all of these terms.